Hello, everybody. I am Kayla Cosmo, and the topic of exploration that I will be presenting today is panic disorder. Now, what is panic, or what are panic disorders? Well, according to the Anxiety and Depression Association of America, a panic disorder is diagnosed in people who experience spontaneous, seemingly out of the blue panic attacks and are preoccupied with the fear of a recurring attack. So, to put this in not so clinical terms, what this means is that it's not just a generalized anxiety thing, it's different from an anxiety attack. This is the fear of full out panic out of nowhere. Some of the symptoms are numbness in your hands, hyperventilating, sweating when it's not even like hot outside, chest pains, and other things. And since these like symptoms are so serious sounding, a lot of people that experience panic disorder think that they have other medical issues at first. So they'll have a panic attack and be like, "Yep, this is it. This is a heart attack." And so that's how serious a panic disorder can be. The category of disability that this is classified in Muser is an emotional disturbance or an emotional disability. And things that classify an emotional disability in a student is that they must have one of the five symptoms. They have to be either inappropriate, or they must exhibit either inappropriate behaviors or feelings under normal situations, pervasive moods of unhappiness or depression, the inability to build and maintain relationships with peers and teachers, physical symptoms or fear related to school or personal problems, or the inability to learn that cannot be explained. So, the reason why panic disorder is classified under an emotional disturbance is because it shows inappropriate behaviors or feelings under normal situations, because panic attacks just happen out of nowhere and they happen because normal situations can become overwhelming. And it can also fit under the physical symptoms or fear related to school and personal problems. So, outside influences do have an impact on a person, and they do have an impact on panic disorders. Implications for the classroom or just for education in general. Students with panic disorders can become easily overwhelmed in a classroom setting and when involved in group work. And what this is saying is that students with panic disorders, like, since they become overwhelmed easily, or since they can become overwhelmed easily, that classroom settings can be very stressful to them because there's a lot going on, there's a lot of pressure because you gotta focus, you gotta get good grades, and group work is a social aspect that stresses out people that don't even have panic disorders or anxiety disorders. Being thrown into groups where you're not comfortable is just you well, you can guess it, it's uncomfortable. Another implication for the classroom is that um, they can have students with panic disorder can have a hard time focusing on their schoolwork or socialization, like outside of the classroom or even in the classroom, because panic disorder, as defined, is having this constant fear of having another attack happening or having just panic in general. It's not even just a full blown attack, it's the build up to it too that you're constantly worrying about. And when you're focused on that one thing, it can make you distance yourself from people and situations that you don't want to be a part of. And it can just also make it harder for you to integrate into the classroom. And students with panic disorder might also have low attendance because they might just not want to show up to school because they don't want anything to happen. They don't want to get overwhelmed by all the stimuli happening. They could also have low attendance because of embarrassment or shame, because of people know that they have panic disorders or they don't want things to happen in front of people and stuff like that. And it is shown that students with anxiety disorders and panic disorders can can tend to have a lower attendance in class because of it. Recommended teaching strategies. So the biggest recommended teaching strategy that I found was to incorporate more movement into lessons and lectures, because this helps you focus on something. And it can be as simple as putting up like post-it notes around the room and having groups move to the different things. And or it could be something bigger, like bringing things to a different area or bringing things outside, because a change in environment can help with that. However, on the flip side, a change of environment can also be too overwhelming. And so that's why bringing things outside into nature is a good strategy, because nature tends to calm people down and it's not as overwhelming as having the walls around you and all the stimuli of the classroom, like posters and noises and everything else that happens inside. And another teaching strategy is that you can promote relationships in class. And so by this, I mean, not only should you promote like a comfortable relationship between you and the student so that they feel safe, but you should also try to get the student to feel more comfortable with their peers and the people in their class. One of the ways that you can do this is when you're about to have them do group work, instead of saying, okay, everybody, I want you to find a partner, or okay, everybody, I want you to gather up in groups of 3 or 4 or whatever, it doesn't matter. Instead of putting students in the situation where they have the choice of what they should do, every once in a while you could try doing things where um where you choose, and that way nobody feels like they're going to be left out, or nobody can just sit there awkwardly because they don't want to throw themselves into a new social situation for the fear of getting rejected. And so if you say, okay, everybody count off 1, 2, 3, 4 around the room, something random like that, or if you just assign them yourselves, like Joseph, Mary, and Margaret, I want you all to work together. It makes it so they have a situation that they know is for sure and it's not left up to their peers around them. Recommended accommodations. So, preferential seating can help a lot with students with panic disorders. You could have them sit next to the doors to allow them to leave class for breaks, or if a situation was to arise where they had a panic attack. Or they might just feel more comfortable sitting next to a friend or a certain person that they know they are safe around. It's really depends on the student. However, having preferential seating also kind of gives a student with a panic disorder a sense of control, because they're choosing where they are. They know that they will always have the seat in the classroom, and so they know that it's their spot, and they won't be thrown into the awkward situation of if the spot they were sitting in yesterday was taken up by somebody else, and so they have to scramble about the classroom for a new seat. It just gives them that sense of control. Another accommodation that you could use to help your student with panic disorder is to let them tape record your lessons or lectures. And when you let them do that, it gives them the opportunity to look over the lessons later and take notes if they need to. And it also makes it easier for if they're sitting in the class and they're not paying attention because they're stressed out or panicking or whatever the reason is, they have the opportunity to go outside the class in their own area that they deem comfortable, and to look over the notes and study. And so that way they have the opportunity to stay as caught up as everybody else in the classroom. And the last accommodation that I have written down is you can give them early availability or early access of the textbooks and of the syllabus. And so if they have the textbook beforehand, they can read over the material or glance over the material, and so they know what's going to happen and they can prepare themselves for it. And also, if you give them early access to a syllabus or just access to a syllabus in general, then it makes it so, again, like the textbook, they know what's coming up. And also, if they were to miss something, they can look back and see what they missed. And so they can go either ask you about it, ask a friend, go to the textbook to read it themselves, and they can catch up. And it also gives them ability to look ahead if need be. And so if they know, oh, hey, there's a thing going on and I feel like I won't be in class that day, that they can look over the syllabus, figure out what they can do, and then plan from there. It gives them the ability to look ahead, and so things don't seem as big and as stressful as it would be if they had no idea what was going on. Recommended modifications. So, as we all know, modifications and accommodations are two completely different things. And modifications kind of aren't aren't aimed towards equal access like accommodations are. These are aimed at modifying the classroom or the lessons so the student can better access their education. Modifications for students with panic disorders can be the give them extra time when needed on testing quizzes. And so that way, if they are stressed out about the time crunch or if they are thinking about panicking, like it was discussed earlier, then they have the opportunity to sit down and to finish their quiz and to not waste their time on a timed quiz worrying about not making the time. Another thing is that you can set up one-on-one meetings with the student. This makes them feel like they have a voice because they do. They can express their concerns that are happening within the classroom. They can give you recommendations on what methods tend to help them. And you can also check in on how they are doing as far as keeping up with the work and what they feel comfortable with if a situation was to arise where they did have a panic attack or some other emergency. And so the two of you can plan out a strategy, if whether it be getting them out of the room or moving them to a different area of the classroom. You guys can plan it for their individual needs. And speaking of leaving a classroom, another modification is to give the student with a panic disorder the option to leave the classroom for a short while if things get too overwhelming for them or whatever else may happen. And this isn't just you saying, "Oh yeah, I don't really care if you stay in my classroom, like just leave." This isn't you giving them a free pass to leave your classroom for the rest of the day and to not learn like the other students. This is you giving them the option of having a quick couple minutes break to catch their breath, calm down, whatever they need to do to get themselves ready or prepared to go back into the classroom. And sorry about that. It also gives them the opportunity to collect themselves. Sorry, I lost my train of thought after that cough, but we're going to move on. Okay, so here I have a link for the case study of Katie, and I would like you all to read this case study over as a class, if you wouldn't mind. Now, the thing with this case study is that the way it is worded as an adult and not as a student. And so it will talk about what Katie is going through, what she uses to cope with things. It's very quick. However, it is talking about adults. So if you guys wouldn't mind, I would very much prefer it if you could think of this case study as if Katie was one of your students, because it is very easy to imagine just Katie in a classroom setting. And after you do that, then there are these lovely case study questions on the next slide that I would like you to get into small groups of 2 or 3 and talk about the bulleted questions below. And when you are, and keep in mind the whole time you were thinking of Katie as your student, and when you are done with that, I would like you to all go around the classroom and share what your group talked about and discuss if there are differences or similarities that you all have brought up.